Assalamualaikum to me or Miss Odi. Our group will be present about cerebral anaphylaxis attack trigger complication in diabetes mellitus patient. And this is our group member, which my name is Nur Shuhaida Asnida. My metric number MS66, Nur Ana MS67, Danisha MS3, Nizato MS20, and Nashita MS50. Introduction. What is anaphylaxis attack? Anaphylaxis is a severe, potentially life-threatening allergic reaction. It can occur with seconds or minutes of exposure to something you're allergic to, such as rice, fresh juice, seafood, meat, antibiotic, dust, and many more. The cerebral anaphylaxis attack will trigger complication in diabetes mellitus patient. This can see when patient blood sugar suddenly spike, urticaria, ras angioedema, hypotension, dyspnea, trouble breathing, abdominal pain, anxiety, confusion, coughing, slurred speech, swelling, low pulse, sneezing, difficulty, swallowing, itch, skin swelling in mouth and throat, nose, short allergic. That the attack from minor local symptom to severe generalized allergic reaction. Based on the study conducted randomly among 50 correspondents to identify relevant of root factor on anaphylaxis attack among diabetes mellitus patients. Frequency table clearly show most of the diabetes mellitus patients prefer to have rice, where 18.1 on their diet instead of other type of grain. We would realizing the short rice have lower content of amylose and amylopectin, indicate high glycemic index (GI) of rice, where they can quickly digest and absorb. Pass my present to next presenter.
My name is Dinersha bin Wanazri. My metric number is MS03. Research question. First one, what is the risk factor of anaphylaxis attack among diabetes mellitus? Second one, what are common causes of anaphylaxis attack among diabetes mellitus patients? Third one, any symptoms show that can be observed to identify the patient condition? And last but not least, what factor cause repeat anaphylaxis attack on diabetes mellitus patient? Research objective. It divided into two objectives, which is general objective and specific objective. For general objective, to identify risk factor of anaphylaxis attack among diabetes mellitus, while for specific objective, to identify the cause of anaphylaxis attack, then to identify the symptom of anaphylaxis attack, then to identify which flavoring will trigger an anaphylaxis attack, and to identify prevalence of routine factor among diabetes mellitus that trigger anaphylaxis attack. Research methodology. It begins from research design, case study, which is analytical approach, then proceed to research subject data and analysis. Then after that, it proceed to data collection, primary, which is journal, secondary, questionnaire.
Assalamualaikum, my name is Nizat Akbar Bintayub. My metric number is MS20. I will present about literature review. Allergen can be more intrusive for individuals with diabetes. Diabetes can alter the body immune system and reaction to both allergic symptoms and allergic medication. The allergic attack will cause cells to become inflamed, leading to insulin resistance. This process, called edema, is a common diabetic type response. Food allergies and intolerance can cause insulin resistance. Ingesting certain food that cause inflammation, disrupting of insulin production and other body system process of which contribute to the abnormal metabolic state will lead to fatal in some case. In order to avoid anaphylaxis complication among the diabetes mellitus patient, healthcare providers should encourage every diabetes patient go for allergic test, either blood test or skin test. This test will help patients to understand what happened to their body and how to control it. In some cases, anaphylaxis attack develop after some time patient getting diabetes due to the inflammation and compromised immune system. Health providers should reverse the medication issue to the patient with reasonable dose to avoid medication allergy and complication in the long run. The Ministry of Health should conduct public awareness on dangers of allergic attack in the community. The second objective, to identify the symptom of anaphylaxis attack, symptom and allergic attack from random study. From here we can see hive and blood sugar spike suddenly is the highest percentage and frequency, which is frequency 6 and percentage is 38%. Following with dry skin, frequency 5 and percentage 31%. Following with flu suddenly, sneeze suddenly, short breath suddenly, and watery eye suddenly, which is frequency 4 and percentage 25%. And the last one is asthma and limb swollen, which is frequency is 3 and percentage is 19%.
Assalamualaikum and good morning to Madam Odi and Madam Tia. Okay, I'm Nora Rahman from Group Jabal Halan, my metric number 67. I'm going to present about general objective to identify the risk factor of anaphylaxis attack among diabetes mellitus. Okay, first the risk factor of anaphylaxis attack is a food allergic, seafood, meat, nuts, legume, vegetable, beverage, milk or juice. Okay, this journal was published 2015 from Mr. Smith. Okay, next is medication allergy, insulin resistant, antibiotic like penicillin, non-steroid anti-inflammatory drug like aspirin. Okay, published by 2007 by Miss Kaya. Okay, next the common risk factor, household chemical allergy, fruit cleaner, bar soap, cosmetic, pesticide and herbicide is published by 2010 by Miss Mary and Duncan.
Assalamualaikum to the lecturer and all my fellow friends. My name is Rashida Banu binti Abdullah and my metric number is MS50. Okay, now I'm going with the next slide. It's a result slide. So the result is about cause. To identify cause of anaphylaxis attack among diabetes mellitus patients. From this bar chart, we are known they have a few situations that will be triggered for diabetes patients. Okay, the first until the last one, we are going by one by. The first one is dust, food and beverage, fur, changing weather, sweet, medication, and the last one is a cold weather. From the bar chart, we are known the dust is the highest triggered situation for the diabetes patient. Because of the dust problem, they had been short breathiness. So, okay, from our survey, we are known most are them attacked by the dust.
For our third objective is to identify which flavoring will trigger anaphylaxis attack. As is shown on the data below, flavoring intake based on random study, which is sugar intake with 45% of percentage, while salt intake also 45% in percentage, and seasoning intake with 32% in percentage.
For our fourth objective is to identify the prevalence of root factor among diabetes mellitus that trigger anaphylaxis attack. As it's shown on the data below, prevalence root factor from random study is the first one is eating habit, were 6 at frequencies with 38% of percentage. Second one is prevalent were 5 at frequencies with 33% of percentage. Third one is 18 root were 5 at frequencies with 33% of percentage. Fourth Fourth one is sleeping habit were 5 at frequencies with 33%, and fifth one is daily route were 5 at frequencies with 33% of percentage. Sixth one is sport of exercise route were 8 at frequencies with 50% of percentage. Seven one is in aircon room were 2 at frequencies with 30% of percentage. And last but not least is medication were 4 at frequencies with 23% of percentage. I want to pass my present to next presenter.
Okay, now I'm going with the discussion slide. Okay, based on the discussion, based on our survey, we had a 15 correspondent. In that 15 correspondent, we are divided by 3 categories. Okay, the first category, they are rice taker. Okay, they have 81% they are taking of rice. Because of the rice, they have the diabetes will be increased and not in stable condition. Okay, rice, we can take a rice once a daily, or we can take a normal rice, normal grain rice. It's not about like a brown rice or any other rice which is healthy for our body. The second thing is a cold water. Okay, most of them will be think what happened for the cold water. Okay, the cold water give our body temperature heat. Okay, when our body temperature started to heat, the diabetes patient will get sweat and other problem like a shortening of breath and anything kind of problem. Because of that, there are most taker are cold water, and most of them will be known about the cold water. Cold water will be heated our body, and the heated body will be increase our sweatiness, and it becomes short of breathing and respiratory problem. Okay, and the last one, we are known intake of salt and seasoning is a 75%. Okay, how about sugar? When we take sugar, of course, automatically the diabetes patient will be increased the diabetes, and the salt and seasoning also a kind of affected and all triggered the diabetes patient to increase the insulin. So, because of this, the allergy will be active or triggered by this of kind of items. It's a rice, cold water, and the seasoning or salt. Thank you.
Okay, next I'm going to present about limitation and suggestion. Okay, when we first time conduct this subject, okay, we said very difficult for us to find the journal that related the case study via online channel. We did not use the correct term when we do research from Google's and other search engine. And then we suggest that in order to find a curate the journal or material reading, we will simplify the search terms. Okay, next, the limitation that we're facing is the accuracy of data that provided by patient, because some of the question actually they misunderstand it what is the question meaning. That's why we simplify the suggestion, we simplify the questionnaire. Okay, next, we find difficult to find correspondent that meet the criteria that having diabetes mellitus that experience anaphylaxis attack. Okay, what we suggest to encounter this issue in future, before we provide them a form or link, we should inquiry with the patient did they having this kind of problem previously. Okay, lastly, I'm going to wrap this presentation with conclusion. Based on the study we conduct, that diabetes mellitus patient get an anaphylaxis attack due of their routine habit without they realize it, that is can trigger complication in them for the long run. Anaphylaxis attack can be controlled if diabetic mellitus patient taking precautions, going for the allergy test yearly, control their diet, adjust some of their routine to suit their lifestyle, and making a note on food that activity may cause them getting an allergic time to time. Share that share the info with the immediate family member for emergency purpose. Diabetic mellitus patient also have to be aware on symptom of allergic and the level of attack before seeking a medical help. Thank you.